After watching the video, Needs and Challenges of Disaster, I was struck by how clearly it illustrated the psychological progression individuals and communities move through following a disaster. The phases described highlight both resilience and vulnerability. These phases include the heroic, honeymoon, and disillusionment phases. Drawing from the video, as well as Miller's Fundamentals of Crisis Counseling and Gingrich's Treating Trauma in Christian Counseling, I want to reflect on the needs and challenges present in each of these phases and how we, as counselors, can respond effectively. First, let's talk about the heroic phase. The heroic phase occurs immediately after a disaster. During this time, individuals often display extraordinary energy, courage, and altruism. People rescue neighbors, distribute supplies, volunteer tirelessly, and function on adrenaline. The primary needs in this phase are safety, stabilization, and basic survival. This can include food, water, shelter, and communication with loved ones. However, while this phase appears positive on the surface, it presents significant challenges. According to Miller, crisis situations activate the body's acute stress response system. Individuals operate in fight, flight, or rescue mode. Cognitive processing may be narrowed, sleep is often minimal, and people suppress their own emotional reactions in order to help others. The challenge here is that emotional processing is often postponed. Survivors and first responders may ignore their own trauma symptoms. They may also experience risk-taking behaviors because of adrenaline and a sense of invincibility. Another challenge is that helpers themselves are at risk for secondary traumatic stress and burnout. These helpers may include people like emergency personnel, clergy, and counselors. From a Christian counseling perspective, Gingrich emphasize that humans are embodied beings. Trauma impacts body, mind, relationships, and spirit. In the heroic phase, individuals may rely heavily on faith language or spiritual meaning to cope. While this can be adaptive, it can also mask deeper distress that has not yet surfaced. So in summary, the needs in the heroic phase are immediate stabilization and coordinated response. The challenges include emotional suppression, physical exhaustion, spiritual bypassing, and the risk of later trauma symptoms once adrenaline subsides. Now, let's move on to the honeymoon phase. The honeymoon phase occurs days or weeks after the disaster. This period is often marked by community cohesion, hope, and shared identity. There's an increase in social bonding, volunteerism, and external support. Survivors may feel encouraged by relief efforts, insurance promises, donations, and government assistance. However, the honeymoon phase can include what is often called a crash point. So who experiences this crash? It can affect survivors, first responders, and even community leaders. It often occurs weeks to months after the disaster, usually once the media attention decreases and resources begin to withdraw. You may be wondering, why does this crash happen? Well, first, the initial adrenaline has worn off. Second, the reality of long-term loss becomes clearer. Insurance claims may be delayed, homes may still be uninhabitable, employment may be disruptive. The social support that once felt strong begins to thin out. Miller notes that when perceived support decreases and stressors remain unresolved, individuals are at an increased risk for emotional dysregulation. The discrepancy between initial hope and ongoing hardship can produce disappointment and despair. For helpers, the crash may occur when exhaustion sets in, compassion fatigue can develop, and Gingrich discuss how trauma disrupts meaning systems. During this crash point, individuals may begin to question their faith, their safety, or even God's goodness. This spiritual disorientation can compound emotional distress. Therefore, the crash point often affects those who were functioning well before, during the heroic and honeymoon phases, but suddenly find themselves emotionally depleted. It occurs when expectations of recovery collide with the slow and often frustrating reality of rebuilding. Finally, let's go ahead and examine this disillusionment phase. So, during the disillusionment phase, fear, anger, frustration, and even hopelessness frequently emerge. The community solidarity that once felt strong may fracture. Survivors may feel abandoned or betrayed by institutions. Financial strain, displacement, and chronic stress can accumulate. From a clinical standpoint, several conditions may develop during this phase. One common outcome is major depressive disorder, which is typically characterized by persistent sadness, loss of interest, and sleep disturbance. Another is post traumatic stress disorder, or PTSD, which may include intrusive memories, hypervigilance, avoidance behaviors, and emotional numbing. Anxiety disorders may also develop, particularly generalized anxiety or panic disorder, as individuals struggle with ongoing uncertainty. Substance use disorders can emerge as maladaptive coping strategies. Additionally, relational conflicts may increase due to chronic stress. Miller emphasizes that crisis becomes trauma when coping resources are overwhelmed and individuals cannot integrate the experience into their worldview. That is often what occurs in the disillusionment phase. So, what type of treatment is most effective during this time? Well, first, trauma informed care is essential. Counselors must prioritize safety, stabilization, and empowerment. Cognitive behavioral therapy, especially trauma focused CBT, can help individuals reframe distorted beliefs and process traumatic memories. Second, narrative and meaning centered approaches are important. Gingrich and Gingrich stress that trauma disrupts one's sense of coherence. Christian counseling interventions may include theological reflection and reauthoring one's story within a faith framework. This does not mean offering simplistic spiritual answers. Instead, it involves creating space for honest grief, doubt, and rebuilding trust in God and others. Third, community-based interventions are critical. Support groups reduce isolation, psychoeducation helps normalize symptoms, case management services address practical stressors like housing and employment, which are deeply intertwined with emotional recovery. Finally, counselors must monitor for risk factors such as suicidal ideation, severe substance abuse, or domestic violence, which may escalate in prolonged stress environments. In conclusion, the disaster recovery process moves through identifiable phases, but these phases are not linear. The heroic phase is marked by adrenaline and altruism, yet emotional suppression and burnout are real risks. The honeymoon phase brings hope and cohesion, but may include a crash point when resources decline and exhaustion sets in. The disillusionment phase can give rise to depression, PTSD, anxiety, and spiritual crisis, requiring trauma-informed, cognitively grounded, relational, and spiritually sensitive treatment approaches. As counselors, our role is not only to address symptoms, but to walk alongside individuals as they reconstruct meaning, restore safety, and rebuild resilience across psychological, relational, and spiritual domains. I've included the following resources in my response. Gingrich and Gingrich, 2017, Treating Trauma in Christian Counseling, InterVarsity Press. Miller, 2012, Fundamentals of Crisis Counseling, Wiley. And the Needs and Challenges of Disaster video provided by Houston Christian University. Thank you so much for watching.